musculoskeletal diseases can occur at any age, and early diagnosis is crucial to achieve early access to care and ultimately prevent long-term disabilities. One of my main research interests is to identify novel autoantibodies in rheumatic diseases, and this can help facilitating an early diagnosis in patients that do not display conventional autoantibodies like rheumatoid factors and ACPA.
Rheumatic and musculoskeletal diseases have a tremendous impact on the lives of millions of people all over the world. Both their personal and work lives are equally affected, which can be even worse for young people living with RMDs. Thus, early diagnosis is of utmost importance to reduce the burden of these debilitating diseases. I focus my research on the identification of early forms of spondyloarthritis and also on their long-term outcomes, with the ultimate goal of translating my work into objective improvements on the patient's daily living.
There are many myths about arthritis, like that it affects only people of older age and that it is just a degenerative condition. The truth is that arthritis could be a manifestation of autoimmune rheumatic diseases, sometimes comes with other clinical problems, and that arthritis and autoimmune rheumatic diseases could affect people of every age. During the last years, basic and clinical research have helped to identify the causes of autoimmune rheumatic diseases and arthritis, to give solutions to clinical and everyday problems of these people, and to find new treatments that made their lives better.
Rheumatic and musculoskeletal diseases often receive delayed or no diagnosis, although it is well known early diagnosis is key to preventing further damage. Working in research is my passion. I believe discovering new diagnostic methods continuously reveals new patients in more early stages of the disease, which is crucial for treatment and increasing patients' quality of life. The World Arthritis Day is a perfect way to raise awareness and to highlight the importance of early diagnosis.
Rheumatic and musculoskeletal diseases has an important impact in the quality of life and working capacity of our patients. Because of that, they need an early diagnosis and an appropriate treatment to be established. However, each patient is different, has its own characteristics, and sometimes it requires a different approach. My research is focused on the identification of biomarkers to assist in the early diagnosis, treatment decision-making, and patient stratification in order to improve the clinical management and better treat these patients in the clinical setting. Working together from the university to the academia and to the hospital, and from the laboratories to the clinics, we will improve our patients' lives and we will provide them with a brighter future.
It's important to increase awareness about arthritis. Despite the impressive achievements in rheumatology in the last decades, patients with arthritis still experience functional impairment and reduced quality of life. The aim of our research is currently to deepen the knowledge of the patient's approach to the treatment, and we aim at better understanding what might be the value of the patient's perspective in the management of the disease in order to optimize treatment strategies and to grant all patients adequate access to treatment.
Rheumatoid arthritis is due to genetic factors and environmental triggers. Diet and gut microbes could be one of them. Our aim is to explore whether changing diet and gut microbes using probiotics could prevent rheumatoid arthritis in patients at risk. So if you want to know what are the risk factors of rheumatoid arthritis, don't wait, connect today.
Rheumatic diseases have a huge impact over millions of lives, not only when it comes to disease activity, but also when it comes to psychological aspects, quality of life, and work and societal participation. These aspects go often overlooked or are even purely ignored. I will say our research helps raising the awareness over all these issues by giving a small but important contribution, for example, by finding early referral strategies, early diagnostic tools, by raising the awareness on early diagnosis, by improving the treat-to-target options, and also finding the better targets in collaboration with the patient, of course, by the means of, for example, patient-reported outcomes. So I will say that it's really important that we all make our small contribution, and step by step, we all together raise awareness and fight these chronic diseases.
Hi all. Increasing awareness of any musculoskeletal disease is crucial in the whole disease process. We must make sure that these conditions are recognized as autoimmune diseases affecting every age group, and not as diseases just happening because of older age. Early recognition is important in this, not only from a disease perspective, but also to the patient himself. Patients will suffer less and have a better quality of life. So don't delay, connect today.
Rheumatic diseases are very complex and often have a progressive trend. For this reason, recognize the first signs of alarm and getting to the early diagnosis is essential to limit the damage and treat the patient at the best. This requires a great collaboration between rheumatologists and other specialists, but above all with patients. Sharing the treatment strategy is essential for getting better results and keeping the disease under control. My research remains focused on the patient's needs and perspective, so don't delay and connect today.
Rheumatic and musculoskeletal diseases must be recognized, diagnosed, and treated as early as possible. Raise awareness.